You'll remember me when the west wind moves among the fields of barley. You can tell the sun in his jealous sky when we walked in fields of gold.
So can you describe the first sign or symptom that made you feel like you needed to get things checked out?
Sure. I was just running errands one day and I put my hand up on my neck and I felt a swollen lymph node. And I waited a few weeks to see if it would go away because I figured I was just having some type of infection, and it didn't go away. So I made an appointment to see my primary care doctor.
And when you saw your primary care doctor, what did he tell you?
She told me that she thought nothing was wrong. She ordered blood tests, ordered a chest x-ray. She wanted to make sure that I didn't have either mono or tuberculosis, since I did work in the hospital at the time.
I see. And then, like, how did you find out your initial diagnosis?
All the tests came back negative, and so she referred me to a head and neck specialist. My first appointment with him, he felt my lymph node, and his first words were, "I think you have cancer."
And what was your initial reaction to that?
I was pretty shocked. I felt like I just had an infection. I was waiting to get my prescription for clindamycin or whatever and go home and be on with my day.
And then what happened when you found out you had what was the initial diagnosis?
Well, to get to the initial diagnosis, at that appointment, he did a needle biopsy. So he stuck a needle right into my lymph node, the one that we could feel, to take some cells out. And he took a camera, which he put up my nose and down my throat to see if there was any problems he could see in my neck. And he pretty much said that he didn't think the biopsy would show anything. For Hodgkin's, which is what I ended up having, only a few of the cells are abnormal.
So after all the tests and exams, what was the final diagnosis for you?
It was Hodgkin's lymphoma, stage 2, nodular sclerosing subtype.
And with that diagnosis, what considerations did the doctor discuss with you for treatment?
We pretty much discussed chemotherapy right from the get-go. If my tumor burden had been bigger, radiation would have been an option also.
Okay. And with the decision to go forward with chemotherapy, what things did you have to consider, say with your job and insurance and costs?
There were definitely a lot of things to consider. A lot of thoughts went through my mind and my family's mind at that time. One thing that was really important was that I did have my husband and I did have my mother, so I had a strong social support system, which you definitely need when you're going through something like that. As far as health insurance, I was fine on that aspect, thankfully, or else we would have taken out other loans to pay for it. And my job was very supportive. I got shuffled around a little bit to work in an environment that would be safer for me as far as infection risk went, but I continued to work.
You continued to work throughout your chemotherapy?
I did.
So were there any other considerations before you started chemotherapy?
Yes. My oncologist said that there was a chance that chemotherapy would affect my ability to have children. And I was 27 at the time of diagnosis, no kids yet, and not ready to make the decision that I would never have children. So my husband and I decided to go through the process of freezing embryos, which will be, I guess, in cold storage until we need them. So that process consisted of fertility medications. Every night for about 4 weeks, I had to give myself between 3 and 4 shots every night, and the hormones made me feel just a little bit crazy. Every other day, I would go see the fertility doctor so he could do his measurements of the size of the follicles in my ovary and decide when was the best time to take the eggs out. 2 days before the harvest happened, my husband, had to give me an intramuscular injection in my butt, which was quite an experience for both of us. And we did the harvest. It actually happened on Christmas morning, which was not the way you want to celebrate Christmas, but we have 5 frozen embryos now.
And this was all before you started
This was
chemotherapy?
all before we started chemo. So we made the decision to delay my treatment in order to get that done.
Okay, so can you talk about your actual chemotherapy regimen? Like what kind of agents were used and how often you received the treatment?
Sure. I received a regimen of 4 medications. It was called ABVD, so adriamycin or doxorubicin, bleomycin, vinblastine, and dacarbazine. And I received it every other week. 2 treatments made 1 cycle, so it had like a part A and a part B, and I got 6 cycles. So total it was 12 chemotherapy sessions.
For how long? How long was that?
It was about over a 6.5 month period.
And what did it mean to receive a cycle? Like what did you have to do?
So before each treatment, I had to go to the lab and get blood drawn so they could make sure that my blood work, I could physically tolerate having chemotherapy. The day of the chemotherapy session, I would go see my oncologist so he could just check me out and again make sure that I was ready to receive more. I would go to the infusion center. The nurse there would start an IV in my arm. For doxorubicin, it's a vesicant, so they don't want to put the IV in the hand. They have to put it in the forearm just in case it extravasates. So I would get an IV started in one of my forearms. I would get pre-medications and then the chemotherapy. So I would be there for about a total of 4 hours.
And what kind of pre-medications did you get?
I received dexamethasone
Okay.
and Zofran.
So for your Hodgkin's lymphoma, they used 4 different chemotherapy agents. Why was it important to use 4 different agents?
The 4 medications that they used all worked differently. And so by using medications that worked differently, they were able to use lower doses of each medication, and they targeted the cancer cells at a different part of their cell cycle. And then finally, if there were any cells that were resistant to one, hopefully they would be killed by the others.
So how did your oncology team monitor your progress during your chemotherapy regimens?
Prior to every chemo session, I went and got the labs drawn. So they monitored my blood counts for that. They checked my white blood cell count and absolute neutrophil count to make sure that my immune system could handle more chemotherapy. They checked my liver function and my electrolytes just to make sure that I was ready for more. And then as far as how well the disease was being treated, I had a PET scan halfway through. So at the end of my 3rd cycle, I did a PET scan, and then at the end of my 6th cycle, I did another PET scan. The PET scan after cycle 3 showed significant improvement, but there was still tumor left.
So how did the pharmacist calculate the doses for each medication?
They calculated the doses using my body surface area, and that takes into account both my weight and my height.
Okay. So talking about myelosuppression or bone marrow suppression, did you experience that at all?
I did. I had neutropenia, so my white blood cell count went down very low.
And what happened when your white blood cell counts went down?
I was given a medication called Neupogen to give myself after treatments. For my 1st cycle with ABVD, sometimes people need Neupogen and sometimes they don't. So we actually tried to have me go without the Neupogen for several reasons. 1, it's an injection, and 2, it's a very expensive medication and not without side effects. So we tried to do it without. A week after the treatment, I got sick. I had fever and chills. I went and got my blood work done, and I had an absolute neutrophil count of 200, which is pretty low. Had I actually gone to the hospital while I was sick, I probably would have been hospitalized. And a lot of times for chemotherapy, about 500 is the cutoff of whether or not you'll treat. People are more comfortable with 1,000, but 500 is kind of the lower limit, and I was at 200.
So what happened at that point when they found out your ANC was 200?
At that point, I got told to go straight home. Do not pass go, do not click 200. Go straight home and really don't go outside and don't see people for about 10 days. I also got put on the neutropenic diet, so I couldn't really eat fresh fruit, fresh vegetables. I had to be really careful because my immune system was essentially gone. After my next session of chemotherapy, I started giving myself Neupogen injections. So I did that every night. I started 24 hours after chemotherapy, and I would give myself a shot every night for 7 nights.
And how did the Neupogen work for you? Did it increase your white blood cells?
Yes, Yes, I never had a problem with really low counts again.
Did you experience any side effects with Neupogen at all?
I did. Aside from the injections themselves being annoying and having a little more sympathy for diabetic people now, I had bone pain from the Neupogen. The cells multiply so fast in your bone marrow, when they leave it, it can cause bone pain. So I had bone pain on my lower back was where it bothered me, and I would take Tylenol and use heating pads.
So did you, that was for the white blood cells, the neutropenia. Did you experience any anemia or thrombocytopenia for the red blood cells and the platelets as well?
I did not have anemia, so there was no need for Procrit or EPO. And I also didn't have any problem with my platelet count, so I didn't need any transfusions during therapy.
So during the time period when you were experiencing myelosuppression, were you at risk of infection?
Yes, my risk of infection was much higher than that of a healthy person, since my absolute neutrophil count did drop down so low. We were very careful with who I was around during the times of my treatments. I stayed away from pretty much everybody who was sick, stayed away from crowded places, and we were really good about washing our hands. After one chemo treatment, I did end up with cellulitis, which was an infection of my skin right around where my IV site had been. It was on my arm. It was very red and swollen, and it hurt to move it. So we went to the emergency room and got diagnosed with cellulitis. Got some IV antibiotics, got sent home with orals, and they drew a line on my arm that if the mark didn't get better, I had to go back. But thankfully, it responded to the antibiotics.
So did you experience any nausea and vomiting with the chemotherapy?
I did. I received pre-medications before chemotherapy. I got dexamethasone, so steroid, and then ondansetron or Zofran. And that helped while I was getting treatment. When I got home, I had promethazine, Zofran, and Reglan. I took them as needed at first, and then by the end I had sort of developed a kind of scheduled regimen to help prevent some of the nausea. I had one episode of emesis the night after treatment, which was pretty upsetting. But I would say my biggest problem was with the delayed nausea. It would last for about 2 to 3 days after treatment. So I would take the Zofran every 12 hours.
Do you think the medications helped in those cases?
Absolutely, absolutely. I read something where they did a survey about 10 years ago of what people feared the most about cancer, and they said that they were actually more scared of the nausea and vomiting than they were of death.
Wow.
So it kind of puts things in perspective of how far the antiemetic medications have come. I definitely, while I did not feel good, I definitely did not feel that bad.
Were you able to eat and have a good nutritional balance while you were experiencing this nausea and vomiting?
I tried. It was hard to want to eat. I also had some mouth pain from mucositis, which complicated that issue a little bit more. But I did try to eat well.
So you mentioned mucositis. What is mucositis and how is that managed for you?
So mucositis is when the cells in your mouth are affected by the chemotherapy. The lining of your mouth is very rapidly dividing, and so it gets hit by the chemotherapy. And essentially, I just had a lot of skin breakdown on the inside of my mouth. The first time I got it, I wasn't really expecting it, and it made eating really painful. Nothing sounded good, nothing felt good. After that, I started using Biotine mouthwash, and then also doing rinses with salt and soda, baking soda and salt. And that seemed to help it. It would still get it a little bit, but it was never as severe as it was the first time. So it didn't really affect my eating. Some patients will get it very severely, and they'll have to do something called magic mouthwash, which is a combination that includes like Maalox and lidocaine.
So were there any other side effects that you experienced during the chemotherapy?
Yes. About 2 weeks after my first chemotherapy treatment, my hair started to fall out. People lose hair every day, but when you lose hair from chemotherapy, it's not a few hairs here and there, it's chunks of hair that are falling out, which was pretty upsetting. So once it started, actually my husband shaved my head for me, and then I started to wear a wig when I went to work. But it grew back.
It looks beautiful.
Thank you. I also had problems with constipation. The beginning was worse until I kind of figured out what I needed to do. So I started taking stool softeners, DocuSite, after my first treatment. And that seemed to manage that pretty well. No other...
How about like mood changes? How was kind of like your day-to-day at work? Did the chemotherapy affect your daily performance? I'm sure it was...
I feel like I performed pretty well at work. Thankfully, I got actually moved into an oncology infusion center. So I was with a lot of people that really understood what I was going through. That being said, going to work was about all I could do. So I would come home and just sit on the couch and not have energy to do anything else. Emotionally, I think that I did pretty well during treatment. I had a great support system with my family and my husband and great friends. But I did have a few breakdowns.
Understandable. So after going through the cycles of chemotherapy, what is your cancer considered now?
I am in complete remission. And I have been so for a year and a half now.
What kind of follow-up do you have to have while you're in complete remission?
I have CT scans about every 6 months, and I was seeing my oncologist every 4 months, but we recently increased that to every 6 months.
So how has going through chemotherapy and cancer, how has it changed your life?
It's changed my life in a lot of ways. I think I didn't really expect to go through something like that at the age of 27. I don't think anybody really does. Since then, I've made a few job changes for the better. I've learned to realize that work is important, but it's not everything. That spending time with your family and your friends is what's really important. But beyond that, I do outreach for the Leukemia and Lymphoma Society. I'm an honoree or honored patient for Team in Training. So I'm training for my 3rd event with them. It's going to be my first full marathon. But we've done 2 half marathons, and thank you to our generous friends, we've raised over $15,000 for the Leukemia and Lymphoma Society.
It's absolutely amazing. Well, Tristan, thank you so much for your time, your insight, and just sharing your story with all the students at LIU. I really appreciate it.
You're so welcome.
Aww.
So she took her love for to gaze a while among the fields of barley. In his arms she fell as her hair came down among the fields of gold. Will you stay with me? Will you be my love among the fields of barley? And you can tell the sun